So we need to talk about risk. Modern surgery is very good at minimizing risk, but we can't abolish risk from the equation. And it's important that we have this conversation so that you can weigh up the pros and cons, the risks versus benefits, the rehabilitation and the inconvenience. All of those factors come into your decision making about whether surgery is right for you. So there's quite a long list of potential risks. Thankfully, they don't happen very often. Compliance is important, but even with the most compliant patient, there is going to be a degree of uncertainty, and it's that we need to focus on in this video. So perhaps wise to start with some outcomes data. What's the likelihood of getting a good or excellent outcome from this type of surgery, from MICA bunion surgery? Well, in the region of 90 to 95%. Those are very good odds, but you might immediately ask, well, what happens to the other patients? And the answer is the majority of them will get there in the end. Some of them need more time. Some of them might require more surgery. But it's my job as the treating surgeon to try and get you to that point that you need to be, where you're happy with the outcome. Is that a guarantee? I'm afraid it's not. You can be assured that I and my team will do the best we can to get you there. And from those figures, you can tell that the vast majority of people do get there in the end. But it is possible to end up with an outcome that is less than ideal, that you aren't necessarily happy with, or in rare events, an outcome that you feel is worse than you started off with. No surgeon can tell you anything different, and I'm afraid it is sobering, and that's why we don't enter into surgery lightly. So the main risks are those of infection with any operation, very small with minimally invasive surgery, less than 1% in my practice, but nevertheless something that we have to take very seriously. Wound or scar problems, well, more of a risk with bigger incisions, open surgery, a very small risk with the minimally invasive. Again, in my practice, any significant issues with the wounds is less than 1%. Nerve problems, well, most of the time, if there is a nerve issue, it's a little bit of numbness in the surgical area. You can end up with a little bit of numbness over the upper outer quadrant of the big toe, and that's quite common with either open or minimally invasive surgery because the nerve that supplies that area is very nearby. The majority of patients will see that awareness of any loss of sensation, any numbness, fade over the course of a few months, and it's probably about 3 to 5% of patients who have any persisting numbness in that area, and it would be very unusual for somebody to complain about that. So what about the bone healing? Bone healing is very reliable, but in about 5% of patients, it takes a bit longer than we would expect. We expect it to take 6 months or so for full healing and up to a year for full remodeling. And that's why there is some persisting swelling during that period. Most of the swelling's gone within the first 6 months. But for about 5% of patients, it can take a little bit longer. Thankfully, the bones failing to heal is a rare event, less than 1%. In fact, it's somewhere in the region of 1 in 500 cases in my practice, but that does require more surgery. And I have been in that situation, and we have successfully treated that with more surgery. We've talked about tendons, and they control the alignment. So we put the big toe back in the right place, and the tendons then maintain it in that position. It is a balancing act of forces, if you like, and in a very small number of patients, in the region of 1 in 200 in my practice, the big toe can end up a bit too straight, and that can take a few months or even sometimes longer to develop, but it's not usually to the degree where somebody needs more surgery, but it can be a reason why that might be required, both from a cosmetic point of view and sometimes symptoms, because it can cause irritation in the footwear. The other side to that coin is the bunion coming back, what we call recurrence. And that risk is probably somewhere in the region of 5% over the first 7 to 10 years. With any bunion operation, that is a risk. And it is something that is difficult to quantify over decades because we simply haven't got that data. But we know that there is a potential risk for the bunion to come back in a minority of patients. Somewhere in the region of 5% seems a sensible figure. So we've talked about the wounds, we've talked about the nerves, we've talked about the bones. What about the joints? Stiffness after this type of surgery is very infrequent. If I measure the range of motion before and after surgery, it's probably about 5% in whom there is some loss of movement, some stiffness, but it's not usually something the patient comments on or notices. It's usually me picking that up. There are other risks that we need to be aware of. There's a very small risk of thrombosis. Thankfully, it's very small after forefoot surgery. The data suggests that less than 1 in 1,000 risk of thrombosis. That's a clot in the leg after this type of surgery. We do give you advice about remaining mobile, which is important for blood flow, and I talked in my post-operative video about giving you calf exercises to do after surgery, and those are all aimed at maintaining blood flow. But we will give you that advice, but the risk is very small. Post-operative fractures is another small risk, and it's generally patients who have been non-compliant. In other words, they felt they need to get on with life and they've done too much in the post-operative period and ignored the advice about remaining sedentary. So that risk is in the region of 1% in my practice, and we hope to avoid that. So compliance is really important. If you do sustain a fracture, most of the time we can treat it and get you there, but it can affect outcomes, so it's definitely something we want to avoid. So one of the risks of entering into surgery is that you can sometimes require more surgery. We talked about 1 or 2 of those risks. So we mentioned the bones not healing, which is a rare event, and that would require more surgery. That's somewhere in the region of 1 in 500 cases in my practice. We talked about the potential for the bunion to come back, which, if symptomatic, could be a reason why you elect to have more surgery. And we talked about the very small risk, somewhere in the region of 1 in 200, where the toe might become too straight after surgery. And again, that might require more surgery. More commonly, about 1 in 20 patients, 5%, might need 1 or more of the screws removing or a little bit of what we call recontouring. So during the first surgery, we get the correction we need and we fix the bones with little titanium screws, and they are specially designed. They're chamfered on one edge so that they sit flush with the bone. And then we take away any residual bony prominence in the area after we've done that. There's a limit to how much bone we can take away without compromising the fix of the screws, and we obviously have to make that our priority. Once the bones have healed, which we've said is 6 months or so for proper healing, then we don't need the screws, but we don't go removing them unless we need to. About 1 in 20 patients, as I said, 5%, will come back at about 6 to 8 months and say, look, now the swelling's gone, the toe's nice and straight, but I can feel a bump where the metal is, or perhaps where the contour of the bone has been changed. It's usually pretty subtle, but it can be a nuisance in footwear. And for that, we can offer you a second, smaller operation where we get you into hospital once again, just as a day case procedure, and under a brief general anaesthetic, take 1 or more of the screws out, and we can remove a little bit more bone, recontour that area if need be. And after that surgery, you're back in your own shoes and getting on with life within 2 weeks. So it's not the same ballpark of recovery as after the first surgery. So minority of patients, but important to understand. As we've said, outcomes are really good. Generally, it's just not a guarantee, and we can't create a guarantee, but what we can do is minimize all the risk, and with that partnership between the surgeon and the patient, we can keep those risks I've described to an absolute minimum.